Hello students, good morning. I am Dr. Ambika, Associate Professor in Department of Oral Pathology and Oral Microbiology, Vinayaga Mission Sankaracharya Dental College, Salem. In today's session, we will be learning about biopsy and exfoliative cytology. The word biopsy was coined by French dermatologist Ernst Henri Besner. It is originated from two Greek words, bio means life and opsis means vision. It also serves as a treatment option for smaller lesions by excising in toto. Biopsy is a removal of living tissues for examination in order to obtain precise diagnosis. According to Richard Teich, biopsy includes removal of tissues for examination, microscopic analysis, bacterial analysis, clinical analysis, and or combination of all. Indication of biopsy includes lesions that cannot be definitely diagnosed by other techniques like clinical examination, radiography, cytology, and clinical laboratory tests. Lesions that clinically fails to respond treatment modalities, and also lesions that does not respond to usual treatment within reasonable period of time. For those lesions that clinically suggest malignant neoplastic process, biopsy is indicated. Also in conditions like leukoplakia, erythroplakia, it can also be used for evaluating surgical margins whether complete removal of tumor is achieved or not. Contraindications of biopsy includes in patients with anticoagulant therapy, sepsis, impaired lung function and uncontrolled bleeding, uncooperative patients, or any local infection near the biopsy sites, the procedure has not to be done. Types of biopsies. There are excisional biopsy, incisional biopsy, needle biopsy. In incisional biopsy, wedge biopsy is included. Its modification like punch biopsy, drill biopsy, curettage biopsy are also included. We will be seeing about excisional and incisional biopsy now. First, excisional biopsy. It is a complete excision of the lesion and is commonly employed in smaller lesion which is usually less than 2 centimeters. When the clinical examination reveals the lesion it is benign, it is better to employ this technique, which has added advantage for examination of whole lesion, and in case of small lesion it serves only a form of treatment in most of the conditions. Drawback includes care should be taken in case of malignant tumors where entire tumor has to be removed, or it may be possible to visualize the clinical staging of the tumor. Also in case of excessive removal of adjacent normal tissue, it will be exposed to unwanted radiotherapy. Coming to incisional biopsy, it is the removal of portion of lesion. It is performed when the surface lesion exceeds 1 centimeter in all dimension, and also in widespread lesions total excision is not possible as a chairside procedure. So it is mainly employed to establish diagnosis and confirmation whether the tumor is benign or malignant, and so a definitive treatment can be planned accordingly. Two ways incisional biopsy can be employed, either narrow deep incision or broad shallow incision, but not within the tumor. The tissue for incisional biopsy should include part of the lesional area and part of the adjacent normal mucosa to compare the findings. In the following picture you can see that where the deep and shallow and narrow incisions are being taken, we should take part of the lesion from the tumor and part from the normal mucosa. Next we talk about the biopsy technique. First we should avoid using high colored antiseptic which may act as an artifact after tissue processing. Second, we can infuse anesthesia around periphery of the target area, and then we have to use sharp scalpel to avoid tearing of tissue. So remove the part of normal and part of lesional area and fix immediately in 10% formalin or alcohol, and the tissue is subjected to tissue processing followed by paraffin embedding and sectioning and staining. Finally, the slide with the section of the specimen is ready to be viewed under microscope. So this is how biopsy procedure has to be done. Next, we are moving on to exfoliative cytology. Exfoliative cytology is the study of cells which exfoliates or abraded from the body surface. When the overlying epithelium becomes a seat of infection or any pathology, the cells lose their cohesiveness and the cells from the deeper basal layer may shed along with the superficial cells. microscopic examination of these shedded cells from the surface are harvested by either rubbing or brushing the lesional area. It was first introduced by Papanicolaou in 1941, and advantages of the technique include it is a simple, painless, non-invasive and rapid technique, and also we should know that this technique is only used for study of superficial cells and require other cytological analysis which has to be confirmed by biopsy. Indication of exfoliative cytology includes when the lesional area is extensive and multiple incisional biopsy where is not possible. In this case, exfoliative cytology can be used. And in cases where the lesion swelling clinically innocuous, and in case of follow-up patients of pre-malignant and malignant tumors, exfoliative cytology is indicated. And also in situations where the patient is not cooperative for surgical biopsy procedures, and also in case of infections like candidiasis and viral infections. The basic technique of exfoliative cytology includes the glass slide, cytobrush and spatula and alcohol fixative are the materials used, and the procedure is as follows. Like using the brush or spatula, the area to be analyzed is rubbed and then applied evenly on the glass slide in a circular motion, and then fix the slide. It is then subjected to staining procedures and is ready to be viewed under microscope. The microscopic finding of oral cytology is categorized as class 1, class 2, class 3, class 4 and class 5. In class 1 smear, normal nuclear cytoplasmic ratio will be seen. In case of using pap stain, each layer of epithelial cells takes different colors. If from basal and parabasal area cells are visible, it will be seen as blue or green in color. In case of superficial layer, it will be seen as red or orange in colored cells. So now coming to class 2 smears. So class 2 smear shows slight atypia which may be due to a result of inflammation. Nuclei are of normal size and shape and can be noted in this class 2 smear. So in case of class 3 smear, nuclei of these cells are abnormally large, indicating there may be any malignant changes. In case of class 4 smear, nuclei almost fills the cells and the shape and size of the cells may get altered. In this stage, biopsy is required to rule out cancer. In case of class 5 smears, features of anaplasia are seen predominantly, suggesting the lesions is malignant. So next, coming to features of exfoliative cytology, and we must know that exfoliative cytology is not a substitute but an adjunct to biopsy. It is a simple, painless procedure helpful in follow-up of detection of recurrent carcinoma cases, also very valuable in screening lesions which requires biopsy mandatorily. It is contraindicated in cases of obvious malignancy, submucosal lesion and in non-scrapable white lesions. So advantages, as we already discussed, it includes quick, simple and painless and also a bloodless chairside procedure, and better patient compliance is being achieved in case of exfoliative cytology. And in case of disadvantages, only limited inflammations can be obtained from cytology. Definitive results is not possible in case of cancer and is limited to tissues which exfoliate cells in a reasonable amount and in size. So we have seen that what is biopsy, its advantages, its indication and contraindication, and also what is exfoliative cytology, its advantages, disadvantages, grading of cells in today's session. So thank you for watching my video. Thank you.